Hi there, I just wanted to talk to you all a little bit about the use of nasal sprays after both rhinoplasty and jaw surgery. We use them for several reasons. We are going to recommend the use of a decongestant nasal spray, typically Afrin or oxymetazoline or Neosynephrine, for the first 2 to 3 days after jaw and rhinoplasty. We ask that you utilize this spray because it does help reduce bleeding by tightening some of the blood vessels in the nose. We're going to recommend using it 2 sprays each side of the nose twice a day for the first 2 to 3 days after both jaw surgery and rhinoplasty. When you are going ahead and using it after a rhinoplasty, you will have some small tubes in your nose that are sutured in place. They're hollow, so even though it feels like it's not going anywhere, we still do ask that you try to use it as best as possible. You're going to place the tip of the nasal spray right at the entryway to the nostril, give 2 good squirts on the right and the left, and then you're going to do that twice a day, again for 2 to 3 days. The other suggested nasal spray that we're going to recommend using after both jaw and rhinoplasty is the use of an all-natural saline spray, nothing with menthol or any sort of additives. You can get this over the counter at your local retail pharmacy. Some brand names are Air, AYR, or Ocean nasal spray, but store brand is also completely fine. The saltwater or saline nasal sprays would be used in the same fashion, 2 good squirts each side of the nose, and you can use those as often as every 2 to 3 hours as needed. If you're dry, if you're congested, if there's any sort of bloody debris, moistening those nasal passages is only going to help you feel better, breathe better, and help you clear some of that congestion.
So thanks for listening. If you have any other questions, please check us out on our website, www.dereksteinbacher.com. Thanks again.